What is subfertility?
Well, if a couple fails to conceive after 1 year of unprotected sexual intercourse, then we call it subfertility. We must bear in mind that even for a normal couple who's not suffering from any form of subfertility, the chances of achieving a pregnancy in a given month is only about 20%.
Is subfertility a common problem?
Yeah, subfertility is a common problem. Globally, it is estimated that about 18% of the population, reproductive population, suffers from subfertility.
What are the causes of subfertility?
Well, in order to actually talk about the causes, well, in order to achieve a pregnancy, there are 3 main steps. Okay, so one is ovulation. So ovulation is from in the female ovary, egg must be released in order to achieve a pregnancy. So that's step number 1, ovulation. Then step number 2 is fertilization. So the ovulated egg has to travel down the fallopian tube and then meet a sperm in order for fertilization. So that's step number 2. And then step number 3 is implantation. So the fertilized egg, now which we refer to as the embryo, has to travel down the fallopian tube to the uterus, and the embryo has to implant in the uterus. So anything that hampers these 3 processes happening accurately would result in a couple being subfertile.
How long should one try before seeking help?
We always look at the female's age because that's the most sensitive one. So if the female is less than 35 years of age, then we say you, after trying for 1 year, if you don't conceive, that you need to see a fertility specialist. However, if the female is over 35 years, we want them to seek help within 6 months of trying. This is mainly because we know that the female fertility decreases drastically after they reach about 36, 37 years of age.
What are the treatments of subfertility?
Well, the treatments can range from simple procedures like just talking to the patient and educating the patient, so counseling, to ovulation induction, where some tablets or medication is given for the ovaries to be stimulated, or else a more simpler procedure like intrauterine insemination. We hear a lot about that, IUI, where for example, if the husband's sperm count is low, not very low but reasonably low, then we can actually process the sample and concentrate the sample and then use that to transfer the sperm into the uterine cavity. So that is called intrauterine insemination. So those are the more simpler procedures. So treatment can range from those simpler procedures to more advanced techniques like assisted reproductive techniques.
What is ART?
ART, as I mentioned, refers to the assisted reproductive techniques. In ART, what happens is the eggs and sperm are handled outside the body. So basically what happens is the female, the woman, is stimulated with drugs to produce multiple follicles which contains eggs. Then we retrieve the eggs from her ovaries, so we take them out of the body. Then on the same day we ask the husband to produce a sample, so we process the sample and take all the good quality sperm and we fertilize that in our IVF lab. And then this procedure of fertilization is the main process of ART. So after fertilization, then what happens is we culture these embryos up until day 3 or day 5, and then put the embryos back into the wife's uterus and expect implantation to happen.
What is the overall success of IVF?
The best place to look at the overall success is if you go to the HFEA website in England. HFEA stands for Human Fertilization and Embryology Authority, because every center in England has to report back to this authority. So you get, there's 100% transparency, and we can check for all the rates. And there, if you see, in general, for women who are less than 35 years of age, success rate is about 40%. As we age, this success rate comes down.